Good day, everyone. My name is Amr Ratib. I come from Egypt, and I'm going to introduce to you a technique that I've been using for more than 25 years. Okay, I only have a few minutes, so I'll go direct to the point. I've been using just one product for the last 25 years, so unfortunately I have to mention the name of it. I don't work for them. I pay for everything I get from them. Alopecia, as you all know, is hair loss. Could be localized, diffuse, reversible, irreversible, scarring, non-scarring. And as long as there is an option of medical treatment, we go for medical treatment. We go for surgical treatment only in irreversible cases. Irreversible and extensive case of androgenetic alopecia, male or female, or scarring alopecia due to different reasons. Here we have to be very picky when we choose the patient for the hair restoration surgery. The most important, from my point of view, is the patient should be psychologically stable, having fair, realistic expectations, and there is no medical contraindication for this complementary aesthetic procedure. Through all the years with surgical correction techniques, FUE and FUT are the best. I refer my patients to my colleagues for FUE, though the result is less than the FUT, but it's more cosmetically acceptable. And here's a comparison between both techniques. Still, they are the best if you're going for surgery to treat alopecia. But why search for artificial hairs? It's an addition rather than a restoration, can be implanted in scars, and results are instantaneous. Look at the photos. This is a recent patient of mine. He had a successful FUE operation, but due to the donor area poverty, it's exposed now. So he has better hair view on the vertex rather than the occiput. They harvested more than they should. When did this start? I found references even from the 19th century. Imagine it. They used to cut a piece of sheep skin and suture it to the scalp. From the 1970s, there was a trend at that time. I was young, I was in the States, and I've seen it myself. The artificial hairs were sold in the aesthetic part of the grand malls, and it was a procedure done by non-doctors. It was introduced by Beverly Hills surgeons and using the suture materials. Of course, the results were catastrophic, and it was banned, all sorts of artificial hair from North America until now. Then those people made this invention. Actually, they used the material used for coronary stents. It's basically inert. They took the approvals for it at 1995. 1997, they were in Egypt. I was introduced to them. I paid for the course. I asked for the certificates before doing anything, and I wanted to check that it's safe. So these are synthetic polyamide fibers. They are inert, biocompatible, and we may have a time to talk about inert foreign body inside our bodies because it should be respected. It's resistant to easy damage. It comes in different colors and shapes, and it is implanted in the gallia capitis one by one under local anesthesia. Candidates number one, and in their protocol, I remember that 27 years ago, 26 years ago, the patient should be emotionally stable. It's a foreign body you are going to put in their scalp. They have to be stable and they accept it. They should be free of medical contraindications, and they should be adults, not young. We can do this as complementary to FUE or FUT, and we can do it in scars. Limitations. It does not grow, it has no roots, annual loss 10 to 20%, no regrowth. You cannot change color or texture. Insertion into the gallia capitis, as I just mentioned to you. So you cannot insert it into sideburns, for example. You cannot correct eyebrows or beard or whatever, as you can do with the FUE. Contraindications, number one, again, psychologically, emotionally unstable patients, and a list of diseases that should alert you not to go through an aesthetic procedure. It's not wanted. Preparation and anesthesia, it's very simple, and the anesthesia is local infiltration, or if you are going to work on the frontal area, we can use the supraorbital block. Some diagrams, and this is the hand machines that I'm using. This one, I'm still using this. They have the electric one now. The insertion into the gallia capitis. Fibrosis starts within weeks and is complete within 3 months, and it fixes the hair in its place. Fibers should be implanted, I said, one by one, 2 millimeters away from each other, so they do not merge into one canal, and this will throw it away from the scalp. Implantation within the gallia capitis under anesthesia. If one of the points is bleeding, then you are inside a venule, so you have to distract the hair. We start with 100 biofibers, one packet, and we wait. Wait for the patient's response emotionally, psychologically. Is he going to accept this new addition to his scalp or not? And wait for the immune system of the body. Is it accepting it or it's refusing? It's our body and it has its own rules. And then we start adding monthly, following up with the patients. The maximum for the scalp is 10,000 biofibers. Mind you, you all know that our scalp holds between 100 and 120,000 normal hairs. Artificial hairs, only 10,000 if you can. The aftercare is very simple, just wash. And the procedure, by the way, we need an aseptic technique, not a sterile technique. Just be careful with the patient, be gentle to the patient, be respectful to the body immune system. The patient needs to just do the basics, follow the instructions. We give them written instructions, and we follow up with them. The worst that can happen is rejection. Simple and easy. If infection happens, it's a mistake of the doctor or the patient. But the fiber itself is not a track for introduction of microbes like was with the suturing material before. This is the best part of it. Before learning to implant the hairs, I asked them, can I remove it? It's an easy procedure. It's easy in, easy out. So without any side effects, without any complication, if the patient just changes the mind, I want to wear a wig. There's new treatment emerging. I want to try it. It's very simple to remove. And these are some of the cases in my clinic through the last 20, 25 years. This is a friend of mine. I'm still having him as a friend until now. I sent him to FUE, and he came back to me, please, it's not satisfactory. I don't have a good donor area. So we implanted some biofibers. This lady came to me in one of the centers just hours before I leave. That's the bad result of, ill result of FUE, and we corrected it in one session. Here, this man came to me with cheap fibers, I don't know the brand. I removed them in one session. I treated the dermatitis. I told him, please don't come again. And he came back to try the biofiber, and it worked. And he's still a friend of mine until now because he comes for renewal, for additions. Here's some case of insertion in scars. And so, is there a need? Is there a real need? Is there a value of the artificial fibers insertion? What do you think? And that's it. Thank you.